Meanwhile, more people in the Bay Area and across the state continue to get infected with COVID-19. Now, Wastewater is giving us a murky window into what's happening. KRON 4's Dan Kerman reports experts say the current surge is approaching what we had in the winter and might end up even worse.
Examining wastewater is now giving infectious disease experts a clearer picture of how bad this current COVID-19 surge is.
The wastewater is telling us that it's still at a very high sustained concentration, which means it's actively circulating in the community, and people should continue to take precautions to protect themselves from transmission of the virus.
The surge in Santa Clara County and other parts of the state is approaching the levels we saw during the surge over the winter, with one worrisome difference. It's lasting longer.
The width of this surge is broader than the width of the December-January surge. So at the end of the day, we're going to have more people who got infected during this surge than possibly even in December and January. It's a little early to call that exactly.
UCSF epidemiology professor Dr. George Rutherford says people must protect themselves now by getting boosted, avoiding large crowds, and masking when indoors.
You don't want to get this. It opens the doors for long COVID syndrome and a bunch of other stuff. And your prior infection is not going to protect you for that long. It looks increasingly like with the BA4 and BA5s, for the naturally acquired immunity only lasts for maybe a month.
Experts also suggest if you are infected, not to come out of isolation too quickly.
People are shedding the virus much longer than 5 days. Not everybody, certainly, but a lot of people are. Some people out to 10 days, some people even more than 10 days.
UC Berkeley infectious disease specialist Dr. John Schwartzberg says even though the CDC says if you feel well after 5 days, you can come out of isolation as long as you're wearing a mask, he says that's based on old data. He says a negative test is a safer way to go and will help keep the virus from spreading.
The reason why I would add the rapid test onto that is because the rapid test is usually negative at the time when you're not having much virus, at least enough really to spread. So if you're without symptoms, it's been more than 5 days, your rapid test is negative, I think the chances of you spreading the virus are very low.
Dan Kerman, KRON 4 News.